Weight gain, trouble sleeping, loss of libido, irritability. Many of us have struggled with these issues as we age. They can, in fact, be symptoms of a hormone imbalance.
And menopause may perhaps be the best known example, but hormone imbalance can happen even earlier in life. And, it's a concern for men also.
That's right. And joining us to discuss bioidentical hormone replacement therapy, or BHRT, and why it might be the right choice for you is Dr. Tami Horner from Success by Design Wellness Center in St. Petersburg, Florida. Welcome to the show.
Thank you. It's great to be here.
So explain to us just what can cause a hormone imbalance.
As we age, our hormones naturally start to decline, and more specifically, women's testosterone levels will start to decline in our late 20s to early 30s. And typically, by the time a woman reaches her mid-30s, she will experience symptoms of low testosterone. And a lot of women don't realize exactly how important testosterone is in our bodies.
So why is testosterone so important?
We know from over 80 years of scientific research that testosterone protects our bones, our brains, and our hearts. And if a woman waits until she reaches menopause before she starts hormone replacement therapy, she could lose over 15 years of protection from testosterone.
So what about men? Are we immune to hormone imbalance?
Oh, absolutely not. So most people are familiar with low T in men, but just like women, men will start to experience symptoms of low testosterone in their mid to late 30s. And again, if we're not replacing those hormones until a man reaches his 50s, he's losing many years of protection from testosterone.
Doctor, we hear about HRT, hormone replacement therapies, which a lot of people shy away from. What other options do we have?
I prefer pellet therapy using the BioTE method of hormone optimization. With this method, we start with a comprehensive questionnaire that will give us the severity and the number of symptoms a patient might have from hormone imbalance. Second, we do some simple lab tests that will measure the patient's hormones, nutrients, and thyroid levels. Once we get those lab results, we're able to analyze all that data using the BioTE diagnostic platform, and this provides us a very precise and personalized treatment plan for each patient that includes pellet therapy, nutraceuticals, and peptide therapy for optimal results.
Now you mentioned pellet therapy. What exactly is a pellet?
So a pellet is composed of hormones that are derived from plants. They are the same molecular structure as the hormones our bodies once made. They're about the size of a grain of rice, so pretty small, and they're placed just under the skin in the back of the hip. It's a very simple office procedure. It only takes about 5 to 10 minutes. And once the hormones are inserted, they will steadily release into our bloodstream based on cardiac output. And what that means is when you're more active and your heart rate goes up, you're going to release more hormones into the bloodstream. When you're less active and your heart rate goes down, you're going to release less hormones. And that's more consistent with how our bodies would naturally release these hormones. So that's why most patients prefer pellets over creams or injections that are less consistent.
You also recommend nutraceuticals. Why?
Nutraceuticals are important because most people that have a hormone imbalance will also have a variety of nutritional deficiencies. I was 36 when I had my second son. I was having trouble sleeping. I would wake up in a sweat, and I found myself being overwhelmed by pretty simple problems. So I tried everything that my medical training had taught me, and nothing worked. So that's when I began to research. I learned about perimenopause and hormone replacement therapy, and I realized I had a deficiency in testosterone and progesterone, and once I started optimizing those hormones, I felt like a new person. I prefer the BioTE nutraceuticals because they are clinical grade and they're specifically formulated to support hormone and thyroid optimization, and they also help support a healthy immune system, which is important.
What exactly is the role of peptides?
Peptides are small molecules that deliver messages throughout our bodies, much like hormones do, but peptides can work faster and they can be more specific than hormones. For instance, there are immune-boosting peptides that we can give a patient, and those peptides will travel to the immune system and wake it up, so to speak. But also, those same peptides can act as an antiviral, which means the peptide itself can attack the virus in addition to boosting the immune system.
Oh, that's great.
So now where can our viewers go to get more information?
They can go to biotmedical.com.
Great stuff. Thank you so much. And I'm glad you're back to your old self again.
Thank you
Yes?
for having me. Yes, it's great to be here.
All
Thank
right.
you.
And for our viewers who'd like more information, just go to our website, thebalancing act.com.